38 million people are currently living with HIV, with 70% of these infections found within sub-Saharan Africa alone. Both external and internal factors can help explain these high rates of infection. Let's think of HIV susceptibility in terms of surfing. The surfers on the right are exposed to a higher number of sharks than those on the left. If you surf in an area with a high proportion of sharks, your likelihood of being bitten dramatically increases. This represents the external environment seen within sub-Saharan Africa, where individuals are highly exposed to HIV and therefore are at a greater risk of infection. Now, what if I told you that these sharks are inherently more attracted to red surfboards? Now the surfers on the right have a further increased risk, but this time it's due to their internal environment. This represents inflammation. HIV specifically targets inflammatory cells. Therefore, the higher the level of inflammation, the higher the risk of infection. Although inflammation can be a great way for our bodies to defend against bugs, such as bacteria and viruses, too much of a good thing can actually be harmful. Some women have high levels of inflammation, and although there are known risk factors, including STIs, physical damage, and age, these known factors don't account for the majority of the inflammation observed. South African women are a critical population to be studying because they are at the highest risk of HIV infection worldwide, yet very little is known about the genetics of their immune system. But that's where my project comes in. I'm investigating whether these women's underlying genetics contributes to this inflammation and thereby increases the risk of HIV infection. To test this, I'm taking blood samples from South African women with or without inflammation who did or did not acquire HIV. I'm measuring the levels of inflammation in these samples and determining whether women with high levels of inflammation have particular genetic variants. I'm then testing whether these genetic variants associate with HIV acquisition. Now, am I going to ask these women to stop surfing simply because they're at a higher risk? Absolutely not. Would you want somebody to tell you to stop surfing? I didn't think so. Instead, my project aims to understand the genetics of inflammation so that pharmaceuticals can be developed to block these interactions and prevent infection. I think now more than ever, we can all appreciate how critical it is to study viral infections. My project will help increase our understanding on the genetics of inflammation to help prevent future HIV infections and help combat the HIV pandemic. Surf safe, everybody. Thank you.